Worried you're pregnant? Perhaps you had sexual intercourse and the condom didn't work, or the condom slipped, or maybe you did not take your pill on time and you remembered it after the sexual intercourse. Well, these moments can be full of anxiety and a lot of worry. Hi friends, I'm Dr. Mitali Vasavda, obstetrician and gynecologist. Welcome to my channel, MyGynac. This channel has been made with the sole purpose of addressing such other concerns that you might have about your health. This channel places your health in your hands. So, coming back to the issue that we started to speak about was emergency contraception. So, what exactly is contraception? Contraception is when you use any method, be it natural or pills or patches or surgical, which prevent a pregnancy from happening. Most of these methods employ a simple logic by which the sperm and the egg do not meet, and thereby a zygote or an embryo doesn't come into being, and thereby a pregnancy is prevented. Most people who use contraceptives may be using either pills or IUDs or patches or condoms. The most commonly we see the situation where there are condom breaks or condom ruptures, or the condom has not been used properly, or there have been scenarios where there have been missed pills. If you're an IUD user, most of the times you will not have an issue with using emergency contraception because IUD gives you protection from that. But if you are a pill user and you've not used the pill properly, or you have not been on any kind of a contraception, then in that case, you will be definitely worried about a pregnancy that might have begun. Most of the times, what we write for such scenarios is a progesterone containing pill, or sometimes a combined pill, which are medication that a gynecologist can prescribe to you. These pills have to be taken within the first 72 hours after an unprotected sexual intercourse. The sooner, the better. Now, let's say you have missed those first 3 days and you still want to do something so that you get protected from an unwanted pregnancy. Well, in that case, you can consult your gynecologist and ask them whether you are a fit candidate for insertion or for putting or placing in of an intrauterine device. This is a small device that can be placed inside the uterus by your gynecologist, and it can help you take care of an unwanted pregnancy for up to 5 days after a unprotected sexual intercourse. Now, are there any side effects of these methods? Well, if you're talking about pills, then yes, there could be some GI side effects, such as a little bit of a nausea or a feeling that you might throw up. There might be a little bit of a vomiting. There might be bloating. And all this is because we are giving you a very high dose hormone in first go at a time, and which leads to certain issues with your GI tract. But these are all transient, they are all temporary, and they would pass off in 24 to 48 hours. If you're talking about intrauterine devices as a form of emergency contraception, most of the times these devices might leave you feeling a little crampy, or the next periods that you might get might be a little heavier than usual. But be sure to talk to your gynecologist if you experience any of these side effects. Are these contraceptives or emergency contraceptives safe? So there's this concern with everybody that if we do this to prevent a pregnancy, will it prevent us from having a baby or a pregnancy later on in life? The answer to that is, if you're using the pills for emergency contraception, then it is not something that will prevent you from having a successful pregnancy later on, because these pills act only for a fixed duration of time while you're consuming them. And after that, they have no residual effect whatsoever. If you've, of course, got an intrauterine device fixed, in that case, you need to ask your doctor to remove the intrauterine device when you wish to get pregnant. As soon as you get the device removed, from the next cycle onwards, your fertility returns back to normal. Of course, before prescribing all these pills, it is definitely warranted to speak to your gynecologist, who can decide whether this method or this pill or this intrauterine device is the right method for you. Be very sure to know that using an emergency contraceptive alternative should always be used in case of an emergency. It is not a substitute for a regular form of contraception. because of two or three very important reasons. The first one being, we are putting in the body a lot of hormone in a high dose in a short duration of time, which is going to have many more side effects than if you're using it in small divided doses all throughout the month, which we do in cases of regular contraception. The other important aspect to understand is that although these are marketed as a go-to pill to prevent pregnancies, they are not 100% assured method, which means that it is not a guarantee that if you have consumed these pills within 72 hours or got an IUD within 5 days, that it is going to 100% prevent a pregnancy. Which is why being on a regular form of contraception is much better and much sure a method of contraception if you do not want to have a child. Another very important aspect to understand is that these can prevent a pregnancy, but it cannot prevent a sexually transmitted infection. If you're not sure about your partner, you must definitely get an STI screen or consult your doctor for any sexually transmitted infection that you might have got in the process. In summary, yes, emergency contraceptions work. They are a safe alternative, but it is to be used only for emergencies.